we will see the normal conduction system. As you know, ECG is nothing but it is a graphical representation of the voltages from the surface of the heart. So what we call the ECG is nothing but it is the flickering of a needle of the ECG machine is nothing but a galvanometer. So what you are placing is like two electrodes. You are placing two electrodes in two areas on the chest, and the potential difference between these two electrodes are the what is recorded as the fluctuations. So this graphical representation, we do it on a particular designed paper, so it becomes a what we call the electrocardiogram. So the basic voltages are created on the surface of the heart, which is augmented and which is transduced to a written form. That's what we call ECG. So there is a normal conduction system and a normal electrical system within the heart which produces basically these voltages. So as we know, our pacemaker of the heart is SA node, and which produces the impulses which travels down the internodal tracks to AV node. Then you have the fascicles, the bundle of his, and left anterior fascicle, left posterior fascicles, and the right bundle branch. And you have the Perkins fibers, which transmits all these potentials to the surface of the ventricle. So this is the basic anatomy of a normal conduction system. Now, to record this, we place different leads on different areas of the body. It is according to a electrical principle. Okay, so this is we have in general, we are not going into details of it, but we all know that there are limb leads and the chest leads. So this is how the limb leads are designed, where you have the lead 1 from left shoulder to right shoulder, lead 2 from the leg to right shoulder, then lead 3 from leg to the left shoulder. And you have chest leads which are placed on the precordium. So this is basically arranged in according to an x-axial system. So this is the same x and y axis reference which we use for the mathematics. Here on the x-axis, what we measure is the time, and on the y-axis you see the voltages. That's how the ECG is designed. So the leads are placed according to like the heart and the center of a volume conductor. So heart is placed in the center, and you place the electrodes on different places, and it's in a triangle. Okay, so if you can remember this axis, it's well and good. Even if you don't remember, even if you don't want to go into all the complicated axis systems, it's well and good. I mean, as a specialist, actually not necessarily, I mean, as a general practitioner, you don't require all these things to interpret an ECG. So you just need to know that there are limb leads and chest leads. So, and what the limb leads and chest leads are representing, and where the limb leads and chest leads are placed. So this is a representation of the precordial leads, or what we call the chest leads. Okay, so the chest leads are from V1 to V6. So when you take an ECG, you have to place these chest leads in the right positions. So we know that starting from V1 on the right side of the precordium, then V2 on the left side of the precordium, then V3 in the midclavicular line, V4 in the anterior axillary line, V5 is in the mid-axillary line, and V6 in the posterior axillary. So this is how, and this V1, V2 is in the intercostal spaces. So basically, you have to place the ECG in the correct positions, and then only you will get a normal ECG. So this is how the precordial leads are represented. So you can see that, I mean, this is very important, and you should all remember these represent where the precordial leads are placed represents each wall of the heart. This is clinically important. Even if you don't remember any of the previous slides, this representation and this representative leads should be memorized, and that should always be at your fingertip for a correct interpretation of the ECG. So when we see some changes in V1, V2, V3, and V4, we call it androseptal. So that's it's mainly for the acute coronary syndrome or the ischemic heart disease. So when you say V1 changes in V1 to V4, it's androseptal. And when it's from V1 to V4, it's again, you can say it's anterior. So it depends actually. I mean, when the changes extends to the V4 to V6, from V1 to V6, then it's a extensive anterior. That means the whole anterior wall is involved. Okay, so you can see that, and the lateral leads are 1 and AVL. 1 and AVL. So this is, so just remember this, anterior means V1 to V6, androseptal means V1 to V3, or it can go up to V4. Androlateral is 1 AVL, V4 to V6. Okay. Now coming to the inferior, you have the 2, 3 and AVF represents inferior. And when you want to add lateral, you add the V5 and V6. So we will see the ECGs, and by practice only you learn this. I mean, not necessarily you should memorize it.